the quote I have for today is, trust in your potential and believe that with the right resources and knowledge, you are capable of achieving anything and everything you set your mind to. And this is really to start looking at that bigger mission that you may have in your life. And maybe you don't actually have a clear one yet, but to really keep the passion for teaching this population, it's helpful to have know that you're doing something bigger than yourself. And again, when you have the right resources, when you have the right knowledge, you're capable of achieving anything you set your mind to. So you can hear me okay? Okay. My AirPods disappeared. I have a feeling my son took them to school. So hopefully you can hear me. The lawn guy comes on Tuesdays, so you'll probably hear that in the background eventually, where my AirPods would usually be able to make that sound cancel. But so I'll speak up today and make sure that we can hear. 140 million babies are born in the world each year. Okay. And obviously all those moms are not doing Pilates or even just have the support that they may need. And you have the potential to help those babies have the best start at life through supporting their mothers as a perinatal Pilates specialist. And as you saw on day 1 and day 2, there's a lot of misconceptions out there that you now are armed with the truth and can start helping moms. And then at the end of this session today, I'm going to go ahead and introduce you to the Pregnancy Pilates Impact Academy, where you can learn how to become a perinatal Pilates specialist. Okay, so then we went through what the 3 elements are. Okay, and so we have the confidence in self, we have the competence in your skills, knowing what to do, and that helps you to make that contribution to society, and looking at marketing as making your contribution. If you have any issues or qualms or discomforts about marketing, like most Pilates teachers do, that you look at it as contribution. So this is your potential in helping one perinatal client. You have the potential to help catapult or that ripple effect of your teaching to that woman, to that baby that becomes a child, that becomes a man, woman. And then making sure that we're working through the impactor traits: integrity, motivation, patience, awareness, courage, trust, empathy, and resilience. And that's what an impactor is, and that's what we work on in the academy. Okay, so your impact, again, the importance of personal development and education. Here's just another quote. You want to make the most of yourself. That's the best way to help others. And you want to create, not compete. So this is why I make it such a point to drive in that you don't want to be just regurgitating or just repeating things that you don't really believe in or understand just because somebody else is doing it. This is where that courage comes in, to be able to look at what you're teaching, ask questions, and figure it out so that you can actually give the correct information. Because as you saw, there is so much out there. Just because it's popular doesn't mean that it's true. Just to have fun with that, just because it's popular doesn't mean it's true. Let's go ahead and look at 2 more things that were popular at one time and then they proved to be harmful. So this is the fat-free and no fat diet. If you remember this in like probably like the 80s and 90s, everything said fat free. Okay, like that was how food companies marketed their products. And then they found out among the health problems associated with the lack of fatty acids, okay, which is fat, we can count dry skin, eczema, low energy, impairment of kidney function, slow wound or infection healing. So you can think of this in the moms, right? Vision and learning problems, depression, and even miscarriage. So a low fat diet is also associated with a higher suicide rate. This came out in April of 2016. Just another example of just because it's popular doesn't mean that it's true. There's the resource, and then cars without seatbelts. So I was born in 1976. So I remember not wearing a seatbelt. I remember being in the front seat with my mom, and when we would come to a stoplight, she would do this. Her arm was our seatbelt. And my husband actually, he was born in 1973. He actually was in a car accident and like in a body cast when he was like 2, he said. So it was 1985 that they made the mandate, figuring out that, hey, maybe these cars, these machines that we made that go really fast, maybe the people inside them could be better protected. So obviously, and the research is the instant you buckle up when driving or riding in the front seat of a car or truck, you cut your risk of a fatal injury or crash in half, nearly in half. So again, it's just, the point of that is just to show, just because it's popular doesn't mean it's true, that we evolve in our understanding, and that's what's happening in our education of pre and postnatal, is we're evolving in our understanding. So if we go back to the truth about postpartum recovery, where we used to think it was 6 weeks, and we know now that it's at least 6 months, at least, okay? And then for many women, it can be up to 2 years. That's how it was for me, as far as getting back to the body you're more familiar with, not only physically, but one of the things that used to happen to me that I don't read a lot about, and like people don't talk about, is actually the pelvic floor being able to, people talk about incontinence, like not being able to hold your pee. Well, I kind of had the opposite, where, I mean, it was like a few years where I had to, like, too much information here, but it's helpful. I had to push the pee out. Like, I had to try harder. I couldn't just sit on the toilet and let it go. And that has to do with too tight of muscles, could be to do with too tight, or just the connection was not there still. So there's so many things that we have to understand about the evolution from giving birth to that postpartum healing that you can help your clients through. All right, so today I promoted this training as clearing up the pelvic floor conundrum. And I mean, can I just get a yes that it can get really confusing, because there's so much out there on it now. It's become one of those popular quote muscles or whatever that people are interested in. And obviously in pre and postnatal, it's highly relevant. So this is what the first questions I have for you. And if any of these, if you find any of these true, just kind of give me a thumbs up, or if you're in the chat, you can give me a thumbs up there. And this is actually how it was presented to me. I mean, I've been learning this stuff for over 20 years now. So this is kind of how it's all evolved and how I used to teach it. Was it presented as one of the 4 core muscles? So the 4 core being the transverse, diaphragm, multifidus, and pelvic floor. Okay, so that's how it was presented to me. Was it talked about as a group of muscles, which would be considered the levator ani? Were you taught where it's located in the body? And then were you taught whether or not you should actually cue the pelvic floor? All of these, then I asked, did it make sense to you? Because for me, it did not make sense to me. And so that's when I started asking questions. So this is what you're going to learn today: where the pelvic floor is actually located in the body and how it changes during pregnancy and why it's not really a floor, how breathing affects the pelvic floor, the positive and the negative effects, when and when not to cue the pelvic floor, what exercises condition the pelvic floor, how you can educate pregnant and postpartum women on their private parts, quote, despite the discomfort that the conversation can bring, and when to refer out to a pelvic floor physical therapist. So that's what we're going to go through today. Oh, plus you're going to get the 3 Pilates inspired perinatal pelvic floor conditioning and awareness exercises that you can teach to your next client. And remember that to practice these exercises, your client does not need to be perinatal. Okay, so we went over this on last week. So, but just to review, this is the old perspective. So this is the multifidus diaphragm pelvic floor transverse model. Okay, so you can see how it makes that quote canister is what they call it. Okay, and then the new perspective is that the pelvic floor begins from the feet, okay, and envelops everything into that midline core. Okay, so we start at the underside of the foot to the insides of the knees, the adductors, the hip rotators, pelvic floor is, this is what's connected, the iliopsoas. Oh, the front of the spine, which is actually a tendon that goes in the front of the spine, posterior behind the rectus abs attached to the umbilicus. Okay, so that's your transversalis fascia. Now, what's not mentioned here is the transverse abdominals, and that's only because Tom Myers, for whatever reason, didn't include them. But in other educators who have studied this, they confirm, obviously, the transverse abdominals are connected, which will you'll see evidence of that later. The heart, okay, the chest, the throat, front of the neck, cheeks, and the side of the head. So this is called the deep front line. Again, it's a theory. It is a theory. It's a way of looking at the core from a whole body perspective versus just these 4 muscles, which just it's way too simple. Our bodies are much more dynamic than that. Okay, so let's find out where the pelvic floor muscles are actually located. Okay, so this blew my mind once I, again, started asking these questions and not just going by the book, okay? Because anatomy books, this is what you're going to see, that the pubic bone and the coccyx are exactly across from each other. All right, and then the pelvic floor muscles are kind of there like a floor. This is where they got the idea of the floor, okay? And then you have bladder, uterus, rectum. Now, I like this model because it's super simple and it can explain to clients how the pelvic floor muscles and really most importantly, the organs, bladder, uterus, rectum, kind of get that, how pressure gets pushed down. However, it's not accurate, okay? So all we have to do before I show you this next one, all you have to do is look at, so here's a model here, okay? So all you have to do is hold the model up, okay, and see where, so I'm going to put my finger on the pubic bone here and the tailbone, and this is where they attach, okay? And if I take my fingers away, tailbone's up here, pubic bone's down here. All you have to do is feel on yourself as well, okay? So let me show you now an actual image of, so this is a MRI, okay, of an actual pelvis. And here you can see where the pelvic floor is. So again, which makes so much sense. So let's just look at ourselves real quick. Stop. Let me go back. Okay, I'm going to stop share for a minute. Okay, so all we have to do is be able to know, okay, here's where the pubic symphysis is, and the tailbone is obviously deep within the cheeks, okay? And we like it's not here like this, and this is, I think, where it comes from, is that people, and I'll show you an image in a minute, but because people believe, because anatomists have said that anterior tilt, okay, this is not healthy, that then this tucking the pelvis has to be healthy. And the only way that you get a pelvic, quote, floor where the tailbone and the pubic symphysis are in line, okay, is by tucking the pelvis for most people. Now, here's the catch with that, though, is everybody is different, okay? So also during pregnancy, when a woman is pregnant, the pelvic floor is going to pull back this way because the belly is going to come forward, okay? So you have to have that anterior tilt. Now, I'm going to go back to the share real quick. Okay. All right. So this is, again, you can see all of this here, right? So you got the pubic symphysis, the bladder, the uterus. Now, this is really cool because you can really see how the uterus lays over the bladder and how, as the uterus grows, it pushes on the bladder. Okay, and which is why, one of the reasons why women feel like they have to pee all the time during pregnancy, right? And then you have the rectum back here. And then you have, this is where the pelvic floor muscles would be, okay? So you see, again, where this misinformation is. Okay, now, here's another one. This is from a popular, just a stock photos, Adobe stock, where you can just look up like anatomy pictures and things. It's reinforcing that one movement pattern or way of holding the body is wrong. This takes no consideration, again, for body type, where the pelvic floor actually is, okay, or pregnancy. So again, for body type, if you have a little more of a booty, okay, like I do, and if you were a dancer and you were ever in ballet class and I was always told, so this was always my second position because it was super comfortable because I have a little bit more back here. So being like this is comfortable to me, okay? Well, what do you think they always did? Put your butt under, put your butt under, put your butt under, okay? And what did that do? Well, that locked me out, so you couldn't even move. It's just, so my point is that they're saying here that an anterior tilt is wrong and that a posterior tilt is right with zero context, okay? Now, where this comes from is, again, the belief that if people are putting pressure, if they're just like this all the time and giving in, that can cause low back issues. It can, when you put too much pressure into the low back, when you're dumping into the low back. But what they're not sharing is that if you teach, in this case, a pregnant woman to lift, to hug the baby, okay, like we teach in the training, I think I showed this last week, that it's actually necessary, okay, that we have these abdominals in the front so that when baby grows and mom's coming back here, no, we don't want her dumping in. We want her lifted, but we don't want her tucking, because that actually is going to put pressure down into the pelvic floor. So that anterior tilt that they're saying is wrong here is actually protecting the pelvic floor, the pelvic organs, so that that pressure, okay, well, I mean, the pressure is coming this way, okay? But if you're tucking and the pelvis is perfectly symmetrical like this, pressure is going to go straight down into the pelvic floor. So that tilt is protecting the pelvic floor, protecting it, all right? So again, just another example of just because it's popular doesn't mean it's true or helpful. Okay, so let's talk about breathing. So I was taught lateral thoracic breathing. And this is basically when you focus on expanding the rib cage from the sides and back, that's your lateral thoracic breath, because so many people were used to belly breathing or just not breathing into their rib cage. So that's what we were taught, back and sides, okay? I taught it for 18 years. But there was a feeling of restriction when teaching it. And again, I wish somebody would have told me what I'm telling you about taking information and asking questions about it, because that's always what I thought, was that it's so restrictive, but I just taught it because that's what I thought I was supposed to do. But here were the questions. So the abdominals can't move at all, okay? And this is actually would be considered like a bracing, which again, isn't wrong. There's just certain times where that's going to be more, you're going to be able to brace the abs during times of excessive intra-abdominal pressure, like if you're going to do a pull-up or obviously a sit-up, something like that, where you're almost at 100% of that muscular energy, okay? But not when we're just practicing breathing. You do want the belly to move a little bit, because remember, we want it to be that expansive breath, okay? Expansive. So, and that's the other thing I asked, do you need to keep the rib cage down? Okay, so it was all about like sides and back, right? And again, the reason there was because a lot of people were chest breathers. They would do this, right? So there was, that was the thinking. And then can your shoulders lift? Because if you're expanding, well, the shoulders have to be able to lift a little bit. And the answer was always like, well, yeah, they can lift a little bit, but still you want to focus on the back and sides. Okay. And again, it's not wrong. This is a great way to teach people how to get the sides and back working. Is it most efficient? It's not most efficient, because there's lots of other ways and reasons to be allowing a freer breath. Okay. So this is the research on breathing and core conditioning. We want to encourage a breathing pattern. Oh, this is from the establishing expert-based recommendations for the conservative management of pregnancy-related diastasis rectus abdominis, a Delphi consensus study, which I have an entire course on inside of the Academy. When you sign up, you get access to that. But this is what the research says, is that you encourage a breathing pattern that promotes a tension-free diaphragmatic pattern, a downward motion of the diaphragm, and a lateral costal expansion on the inhale. So that all that means is it's lateral and costal. Okay, so it's this. This is what all that means, is that it's expanding in all directions. And I'm going to show you more exercises today to how to teach that. Okay, so now we're going to look at the iliopsoas, diaphragm, heart, and pelvic floor connection. All right. What I want you to watch in this video.
Sit and stand, and I want you to watch what happens.
is so the TheraBand in there is supposed to be like the psoas, okay? And think about the pelvic floor here as well. So what's happening is, sorry. So what's happening there is your diaphragm is connected to the psoas, okay? This is your deep front line. When you stand up, when your client stands up, it pulls on the diaphragm. So a more efficient breath is going to be taken when you bend the knees, okay? When you're sitting. So here's these are MRIs, X-rays, or MRIs and X-rays of the relationship between the heart and the diaphragm, the fascial relationship. It's amazing. Like, what in a minute, I'm gonna show you the coolest video showing actually the relationship between the diaphragm and the pelvic floor. But every time the heart beats, every time you breathe, the organs are doing this. They're constantly moving, just like that little ball. Where's my little ball at? I don't know. What did I do with my little ball? The little ball full of jelly things I showed the last couple days. That's how the organs are moving. There, you can see right here. Look at this. That's the inhale. That's the exhale. Now watch how the heart pulls down on the inhale. Sorry. Okay, watch how the heart pulls, because there's your exhale. Now here's your inhale. Look at that. Did you see the tendon? Is that incredible or what? Like, that is fascinating to me. What? Look at that, the tendon, how it pulls. So imagine what that's doing then to everything else, right? It's pressing down. Okay, so this is again just a visual. The psoas relaxes in a sitting position, okay, along with the surrounding muscles, fascial organs, allowing the diaphragm to release, also allowing the pelvic floor to release and allow for that expansive lateral breath. So the psoas lengthens when standing, pulling on the diaphragm, which is not a bad thing. These are all, we have to have all these different positions, right, to condition the body. Okay, this is the video. I just want to make sure, hold on, I want to make sure you can hear him. So when I share, you have to share sound. Okay, so this is Brent Anderson. Okay, so he's the founder of Polestar Pilates. He's been around for decades. And I'm not Polestar trained. Someday I would love to take their comprehensive training, but I love him. And his approach to not only just in volunteering to teach Pilates, and he's a very spiritual man, and he is all about caring about the client experience. And he was able to get a X-ray or MRI, I guess, or what is that? When you do I'm blanking on the name. You know what I mean? So he's got the pelvic floor and the diaphragm. Okay, now listen to what he says here.
Hi, my name is Brent Anderson from Polestar Pilates, and I'm here with Hadar Schwartz from Israel, a colleague of mine.
Can you hear that?
In the physical therapy world and research world and Pilates world. And we're here at the PMA conference in Denver, Colorado, the 2015 conference. And we're excited because we actually are spoiled with two beautiful ultrasound machines. And we're able to sort of test the waters on some thoughts and some philosophies we've been teaching for a long time, particularly about the hydraulic amplifier and the relationship of the pelvis to the pelvic floor to the diaphragm. So what we're going to look at now is that beautiful relationship of the pelvic floor to the diaphragm as we see that inverse relationship of descension and ascension of both. And we always talk about the hydraulic amplifier and this relationship between the diaphragm and the pelvic floor. And one of our interests is to see how spontaneous organization takes place in these areas with breath. So what we're observing now is that as she breathes in, the pelvic floor drops down and the diaphragm drops down. As she exhales, we see the diaphragm rising up and we see the pelvic floor rising up. So we see this real beautiful relationship that we've hypothesized, but it's nice now that we actually are capturing the information with 2 ultrasounds to be able to do that. The other thing that we're looking at here is just the ease at which the pelvic floor naturally responds to breath. And I think it's important for us to understand that sometimes we over-recruit and we ask our clients to do volitional contraction of the pelvic floor. And what we think we're seeing now is just when people use natural breath is one of the best facilitators of natural displacement of the pelvic floor as well as the diaphragm. In contrast to that, when we see people over-recruiting and over-recruiting the pelvic floor, over-recruiting the abdominal wall, we actually see a decrease in this beautiful relationship of the diaphragm movement and the pelvic floor movement in their normal natural relationship. So tip of the day is if we do a little less cueing on the contraction of these muscles and a little more cueing on breathing and natural organization of the spine, the column, the rib cage, the pelvis, I think we're going to see a much healthier pelvic floor and diaphragm.
Love it. I love him. So, okay. So now we saw this the other day. This is just an animation of the diaphragm, multifidus, pelvic floor, and transverse abs, okay, which is used. I teach an extended training of this in the academy. It's used to teach your clients how their muscles work together. Again, incredibly simplified, but necessary to be simple in teaching. So you see here again, you've got, that's relaxing. There's your inhale. There's your, that's your inhale. Yeah. And then here's your exhale. That's it. Inhale and exhale. Okay. So that's what needs to be, that's what a healthy relationship between the diaphragm and the pelvic floor and the surrounding myofascia looks like. Okay. Now, the reason why this is important to teach is because we're talking about pre and postnatal women who have had all these areas stretched out. Okay. And now they are healing from this. Totally different ballgame than your just basic, person who's never had a baby before. And they just have that natural movement with no tension. So now, let's just answer this question real quick. Is it helpful to teach clients about their pelvic floor anatomy? Yes. Okay. Yes. The short answer is for sure. Yes. Educating women on their private parts gives them a sense of autonomy, personal independence, and self-sufficiency. Anatomy is just the beginning. The latest research shows that prenatal pelvic floor education is a key aspect in reducing the risk of pelvic floor trauma during pregnancy, birth, and postpartum, including reducing anxiety when it does occur. So what's usually missing is in the education is explaining it in a functional way, just like in everyday movement and in psychological factors. Okay. One of the psychological factors is that the nervous system will tell the pelvic floor what to do. So if a woman is stressed, for example, a specific example, that my friend and colleague, Dr. Sarah Duvall, a pelvic floor physical therapist, gave me the example of was that she had a patient that said every time she would come downstairs to feed her kids, she would I think she was dealing with prolapse, feel the prolapse get like worse from like tightening up. That's a nervous system thing. So that's why teaching from that biopsychosocial perspective is so critical. Okay, so let's talk about the discomfort of it. So I don't know about you, but I was raised in the era that you don't talk about your private parts. That's just how it was. So when I came into this field and, you know, we're introduced to pictures like this and models like this, it was uncomfortable for me because nobody ever taught me about that stuff. So I had to not only educate myself, or I was told that it was bad and wrong, right? And so this is what your clients are dealing with, that they are on their 5th baby and nobody's ever explained the pelvic floor to them at all. And doctors don't do this. Doctors do not educate their clients on what's happening. So this is where, again, you get to bridge that gap and help them. Now, if it's uncomfortable, Dorianne, is this just give me like, is it uncomfortable or is it like totally cool with you? It's cool with you. Okay. So that is amazing. Like, you're in the minority, just so you know, like, and it probably has to do with age. You're a little bit younger. So we're talking like the women that are in their 40s, you know, we were raised in the 80s where like that was bad. And this is what we're dealing with. So as somebody who is comfortable with it, which is fantastic, that means you don't have to worry about that. What you do want to pay attention to, though, is how your clients respond to it. But the fact that you are comfortable with it, your clients are going to be comfortable with it. So it's crucial to do that. You can get these on Amazon for at this point. I mean, they're pretty inexpensive. You can get them for like $50 these days. They have different models and stuff, but it is helpful to teach your clients what's going on in their pelvis. Okay, so to understand the core and pelvic floor, we have to look at how the human body begins. Okay, so this is, again, just another sample of the deep front line. All right, so what we're looking at here is how we begin, how each human begins in the womb. Okay, our fascia and connective tissue system begins in the womb as one essentially folding over itself again and again and again, and then we become these amazing walking around self-sufficient humans. It's really miraculous. And because it's so common, it's taken for granted. And that's one of the fun things we get to do, is bring the excitement back to our clients. So in a human body, when one part is removed, the whole is affected. And an example is Tom Myers, who is the inventor of the anatomy trains theory with the deep front line. He was a massage therapist, and he found that the majority of his women clients, older women, 50s, 60s, who came in with neck pain, had also had a hysterectomy where they have taken the parts out. Okay, so you remove a part. Where's my uterus? I don't know where my uterus went. Must have fallen out of here. But let's just you remove a part. Okay, so you remove a part from here, and we're talking about everything up here, right? Well, there's going to be a hole there, okay, or a space that has to be filled somehow. So what happens is everything, all the organs are going to descend to fill in that missing spot. And what that does is it pulls on everything else, because you can see everything is connected. So also, when one part moves, the whole moves. Again, all you had to do was look at that breathing to see how everything moves. So just looking at how humans develop helps you understand how that origin and insertion theory can't be accurate. So just try this. And this is really like not only for us, but also this is fun to do with your clients, just to get them to buy in to the fact that everything is connected. just take your left hand and put it on your left lower back, and then move your right arm around. And that's just very simple example of how everything is connected. You've got to have, everything is working together. All right, so if everything is connected, what does that mean for the pelvic floor and core? If Pilates is a whole body method of exercise and the pelvic floor is a part of the whole, then Pilates already conditions the pelvic floor. Here's the research. Pilates was found to be just as effective as pelvic floor muscle training to help incontinence, and people who continuously did Pilates found that the incontinence did not reoccur. Okay, this is not only in research, this is, I have students, okay, who have come to learn this stuff for their clients and practice it themselves and find that their incontinence disappears. Pilates is a whole body exercise. So if you're doing it efficiently, where you're not doing that belly to spine, where you're pushing the organs out, if you're doing the proper lower abs, middle abs, upper abs lifting, you don't need to cue the pelvic floor when you're doing Pilates exercises. Okay, so the answer, okay, so let's do this first. So the lower abs are a window to the pelvic floor. Okay, so remember I told you we were gonna see this later. So this is it, where the transverse abdominals, the abdominals, are connected to the pelvic floor. Okay, if the lower abs are under the pelvic floor, when the lower abs contract, the pelvic floor contracts. All right, so when teaching Pilates exercises, it's sufficient to cue an abdominal contraction by saying lower abs, middle abs, upper abs, and be confident that the pelvic floor is also responding. Okay, now that's not the end of it though. Is there ever time to cue the pelvic floor? Yes. This is when you cue the pelvic floor. When you're doing a pelvic floor awareness exercise, where you are focusing on the pelvic floor as the group of muscles that we're strengthening or waking up or releasing. For example, sitting on the ball and breathing. This is going to be one of the exercises I'm going to show you at the end. That's when you cue the pelvic floor. And in the academy, I've got an entire chapter on all of this, where there's different ways to cue. There's the different areas. You have like the front of the pelvic floor, which is the more superficial. You have underneath, and then you have towards the back. So yes, we do want to cue the pelvic floor when it comes to the awareness exercises. You don't cue the pelvic floor when you're teaching Pilates exercises. So if you're doing footwork on the reformer, any mat work, you don't need to cue the pelvic floor there, because all that does is take away from the entirety of the exercise, and you don't really need to, as long as you're doing these other pelvic floor awareness exercises. This is for pre and postnatal. Now, you will hear me in the academy, even in, Instagram posts that I've done in the past. You'll hear me cue, lift the pelvic floor, lift the organs is another thing that I will say. I'm doing that with specific clients who I already know, they've seen a pelvic floor physical therapist, and we know that they need to be working on the pelvic floor. And so that's where those cues come from. Okay. And so this is that difference between just that cookie cutter lesson, okay, where this is black and white, to your individual client and that biopsychosocial understanding. Okay. So, but this is the gist of it. Okay. Okay. So what about the abs? Do we cue the transverse abs? Yes, the answer is yes to that. Yes, we cue the transverse abs. Okay. And that's where the lower abs, middle abs, upper abs comes from. All right. That is what conditions the transverse abs. Okay. So more movements that condition the pelvic floor. Okay. Walking naturally conditions the pelvic floor and core. Pretty much any daily task that involves your legs moving. And the pelvic floor likes 3D variable movement. For example, playing on the playground with the kids. I always tell moms that they want to be the weird mom, okay, on the playground with their kids. As you saw in that breathing ultrasound, okay, all the woman was doing was breathing and the pelvic floor is moving. So imagine every other thing that a person does throughout their day. Also, I did not mention this in here, sitting for long periods of time. I'm sure you've heard that sitting is unhealthy. It is incredibly unhealthy for the pelvic floor because all it's doing is putting pressure down, consistent pressure down into the pelvic floor with no movement. And this can actually cause prolapse later on down. You do that for 20 years. Okay, so this happened to my mom. She's a bankruptcy trustee. She wasn't unhealthy at all. She was at her own healthy weight. But she worked an office job. And while she did, exercise and she did, wasn't sitting all the time, the majority of her day was sitting at a desk. And at 65 years old, she had to get a hysterectomy because she had prolapse. And I was like, apparently this is like a normal thing. Like people are just getting hysterectomies. And I was just kind of baffled, like, wow, like what? I had no idea. I had no idea that that's what she was dealing with. And it's so much more common than obviously, especially my mom's age will even admit to, because again, you don't talk about that. You don't talk about these things. So the whole point, the message here is tell your clients movement. The movement is going to heal. As soon as they have their baby, within 24 hours, 24 to 48 hours, the hospital, if she's in the hospital, she's going to want to be walking, okay? Walking down the hallway, okay? And then slowly easing into a little bit longer, gentler walks, okay, as the days progress. Walking is the number one thing she can do, plus breathing, practicing that breathing, okay? Okay, so let's see. Okay, yeah, so this is where the pelvic floor physical therapist advice comes in. So I emphasize you don't need to cue the pelvic floor during Pilates exercises, because if your client has a pelvic floor issue, you want a pelvic floor physical therapist to have confirmed what the issue is, whether she's hypotonic, which is too loose, or hypertonic, which is too tight. Incontinence and prolapse can be caused by the pelvic floor being too tight, and is usually the case with women who are avid hardcore exercisers, okay? So you don't want to be cueing a pelvic floor that is too tight. Once you know from the physical exam, okay, that the physical therapist does, what's going on, you can use that information to add special awareness exercises, which I'm going to teach you one today, to your sessions, okay? And again, we have all of them inside the academy, but I recommend you leave the pelvic floor specific exercises to the pelvic floor PT. So what that means is like there's tons of pelvic floor specific exercises like flicking, and like there's all these little things you can do with the pelvic floor. It's amazing that pelvic floor physical therapists teach. I don't teach those in this course because I'm not a pelvic floor physical therapist, and I feel like we are we are the ones that bridge the gap between that OBGYN and the pelvic floor physical therapist to get that whole body healthy movement in. And then if that's not enough for the pelvic floor, then the pelvic floor physical therapist can do more. Okay, our job is to do the entire body, and the pelvic floor goes along with that. So we're not going to be focusing on tiny exercises with the pelvic floor. It's more about awareness. Breathing is a lot of what we do. Okay, so yeah, important to keep in mind when teaching Pilates exercises to emphasize the whole body, from the feet to the fingertips to the head. When your client is on the reformer and she's starting footwork, you want to make sure her, let's say that she's got her toes, it's the pre-tensile, that all of the toes are connected, that her hands on the reformer, all the fingers are connected, that she's opening up the chest, that the back of the head is connected. We want to make sure the entire body is connected, and that's what helps with the pelvic floor. Okay, I'm making pretty good time here. So here we're going to do these 3 exercises. We're going to start with the spine dance, which is a great warm-up. This is great for pre and postnatal, all stages. Okay, so the spine dance, we're going to do hug the belly. It would be hug the baby during pregnancy, and then we'll do the small ball sitting for pelvic floor awareness. So here we go. I'm going to bring this down. So if you have space, go ahead and we're going to sit. So I had said that I might use the studio, but it was not prepared today. So you didn't really need it. Okay, so this is the plan. So we're going to start with the spine dance. This is actually a Martha Graham warm-up. And fun fact, Martha Graham is a modern dancer, modern dance pioneer. She's actually the one that came up with the breathing technique of like exhale and move. If you're a dancer, you know. And Martha Graham was a student of Joseph Pilates. So this is considered a whole body movement that gets your client moving in all directions. It's a fantastic warm-up. So this is what we do. We start sitting with the feet, heels together, and we're going to bring them out enough that when you place your hands on the shins, or like right below the knees, you can lift up and lean back and have pressure or press the feet into the ground, and you can lean back here. Okay, so watch me like a few times so you can see. I'll show you this way so you can see. So the first one, the spine is moving in all different directions. That's why it's called the spine dance. So you lift first in a lengthened position, and then you contract back. Okay, so contracting back here. Right here, we want that nice round position here that we get in Pilates, lower abs, middle abs, upper abs, stretching here. Okay, so you take the breathing, you inhale, exhale to go back. Okay, you inhale, come back to lengthened position. Exhale, you're going to go over now. Okay, where you're actually diving over. You're going to make a rounded position again. So lower abs, middle abs, upper abs. Okay, then we're going to inhale again. Exhale, lift. Here, notice a little rib wriggle. Okay, then we're going to inhale. I'm going to face this way just so you can see what I'm doing. We're going to exhale, support in the back here, lift to go over, push the self up. Inhale, exhale, over. Inhale, exhale, and lift. Okay. So I like this because once your client learns it, you can add rhythm to it and you can add different things to it. So I'm just gonna go through it with the rhythm and I'll just go through it a few times. Oh, by the way, so if you went this way the first time, the second time around, you're gonna go the other way. I'm also gonna add in a little bit of variable movement through here. And there's going to be moments, we'll do it like 4 or 5 times, and there'll be moments of where we pause and take that deep breathing into the back for those moments of expansion. Okay, so here we go. It goes like this. You're lifting up tall. Take a deep inhale. Exhale, lift to contract. Inhale. Exhale over. Inhale, length. Exhale over. Inhale, lift. Exhale over. Inhale. Exhale, lift the chest. Here we go again. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Lifting up tall. 2 exhale. Inhale, lift the chest. Exhale. Okay, and go again. Lift, inhale. This time, we're gonna come back here. We're gonna do let's do 2 deep inhales. You're gonna inhale. Into the back, exhale. Inhale again. Exhale. Coming back up. Inhale. Go over. Now we're going to breathe here. Inhale. Into the back. Exhale. Inhale. Exhale. Come out of that. We're going to go to the side. Inhale. Into the side now. Exhale. On this one, we can take little movements. Inhale. Come up, exhale. Inhale. Exhale. Inhale. Exhale. And inhale. Exhale. Okay, then to do your variables, you can add, let's see if I show you this way. We can go to the diagonal. To the diagonal. We can go to the diagonal. This is that 3D variable movement. We can go to the side. You're going to shift forward, shift back, back to the side, and come up. To the side, shift forward, shift back, side, come up. This one, we're going to lift. You're going to take a little twist here, and lift. And you can drop the chin here. And this is a really great practice to drop the chin and pull. So you're pulling against these knees to feel the stretch through here, dropping the chin. Okay, and there's lots of variations you can do. Again, this is where I encourage you to use your creativity. You can take a leg here if you want to do some stuff here. But the purpose is to get a rhythm going, to get that spine moving in all different directions. And it's a great warm-up. So that is the spine dance, called the spine dance. Okay. The second is just hug the baby or hug the belly. Okay. So this one, you can do a double whammy. If you have a small ball, you can get a small ball. Another thing you can use is a roller. So you have a few options. So you can use roller or even a pillow. A pillow works too. Or the small ball here. You're gonna grab a pillow? Yeah, go ahead. Perfect, perfect. Okay, good. So I'm just gonna tuck my shirt in here so you can see what I'm doing. So, okay, so we're sitting on the ball here. And what that does is you want to be able to place the pelvic floor kind of into that ball, okay? But make sure that you can press into the shins a little bit so that you have that control, okay? So settle in there. Now, all that we're practicing is lower abs, middle abs, upper abs contracting. This takes the place of belly to spine or scooping, okay? So got lower abs. You're going to take a deep inhale first, okay? So that expansive inhale. Now, you're beginning your exhale from the lower abs, middle abs, upper abs. And if it gets tight, you can take these little movements here, okay? And then you relax it again. And you breathe in again. Exhale. To lift a little bit, you can press into the shins, lower abs, exhale all the air out, middle abs, upper abs. Okay. So that is just one example of hugging the belly. You can do it standing. I like to teach it standing, sitting in a chair, sitting in a car, anywhere that mom can practice that movement. That is the safe way to exercise the abdominals during pregnancy is use. And what we're doing is we're using those abs. And as you're lifting lower abs, middle abs, upper abs, the pelvic floor is responding. Pelvic floor is responding, okay? So now we're going to do the pelvic floor release or awareness, really. And so what this ball does, now this is Carolyn Anthony, who has the Center for Women's Fitness. She's like the pioneer of pre and postnatal Pilates. She is the one who came up with this technique. And again, you're just sitting on a ball, but this time, rather than thinking about the abs here, we're going to think about the pelvic floor. And there's different positions that we can go in to affect different parts of the pelvis, okay? So we're going to go, oh, by the way, this is supposed to be the sciatic nerve. I'm missing the other one, obviously, but this kind of just shows how close it is to how the pelvic floor can affect the sciatic nerve. When people have sciatic nerve pain, if they release the pelvic floor, do you have sciatic nerve pain? You probably are tight. So this is going to be great for you. This is going to be great for you. So this is one of a great thing that you're going to be able to do to release that pelvic floor. Okay. So let's go with this. So, okay. So we want to make sure that we can feel the ball is going to be on the front part of the pelvis here, okay? So right here. Okay, this is the superficial part of those muscles, okay? So we're here. We're not going to worry too much about the shoulders, okay? If anything, you actually want them lifted a little bit so that you have room to breathe down, okay? So all we're going to do is just settle for a minute and just allow, you do want weight on your arms, okay? Because what we're trying to do is release the weight off of the, putting all the pressure down, okay? Now, just bring awareness. If you need to close your eyes for this, that's fine. But what I want you to do is just bring awareness to the front of the pelvis where it's touching the ball. And once you've got that, I want you to take a deep inhale. Now, as you exhale, I want you to consciously see if you can lift the front of that, the pelvic muscles there, okay, the pelvic floor, away from the ball. Now, and this is kind of like if you were stopping the flow of urine, but it's more superficial because it's right in the front. So just kind of take your time with this for a minute and just see if you can even, you don't even have to worry about breathing right now if you don't want to. If you just want to focus on, can I voluntarily feel the front of the pelvic floor, okay? This is your ischiocavernosus and I can't read the rest of my writing, but this is the front, this is what we're getting to, okay? So if you can just feel that you can lift and lower that, okay? It's not physically lifting off the ball. It's just that you can, all the ball does is just allows that tactile awareness, okay? All right, so once you've done that, then let's go to the middle, okay? So the middle now, all we're doing is we're just sitting straight up. Now, this may not be enough to release you, but it's a good start. Dorianne, do you have any of these, the little balls? Like, let me show you. Like something like this or this. You don't have that? Okay. So you can get them. You can just, they're like, you can go to the dollar store and probably find like a bouncy ball. Okay. Like that. But, because, I think, do I have that? Yeah, I'll add this to the resources, this one, but this might be what you're going to need, because you are tight. And basically I have the video for it, but basically what you do is you sit on it like this, but it goes in between the muscles, or I'm sorry, the bones here. And it settles into, it really gets into the pelvic floor in the sense of releasing. So, but that's something you can, we'll work on just what you have right now. Okay. So just make sure again that, you can kind of feel that the whole pelvic floor then is kind of settling in. Okay. So you're kind of, think of like cradling or holding that ball is kind of cradling the whole pelvic floor. Okay. Now, this is where that expansive breathing and being conscious of when you inhale, the organs are going to be pressing down into the pelvic floor, which is going to expand the pelvic floor like we saw in the video. And then when you exhale, it will contract the pelvic floor. So that's what we're going for here. So whenever you're ready, first thing we want to do is exhale all the air out. Okay, then we inhale. And we're being aware of, can we feel the pressure going down into the pelvic floor and into the ball? And then when you exhale, can you feel it slightly lifting? Now, if you can't yet, if this is the first time you've done this, it's gonna take some time to really, it's being able to release those muscles enough to be able to feel that back and forth. So try it a few more times. And again, and you can position yourself however you feel like you need to. Like I'm feeling like, because my pelvis tends to tilt back more, I can be here, and this is actually better for me because it allows me to rest a little bit more and get the breath down. So again, we're going to take all the air out, deep and slow inhale. Exhale. You can even consciously go ahead and hug the belly, okay, on that exhale, and you'll see that you'll feel it much more, okay? So play with, as you inhale, the pelvic floor is expanding. As you exhale, see the difference between just exhaling and then exhaling while hugging the belly, lower abs, middle abs, upper abs. Okay. Are you getting any kind of feeling? Good. Okay, good. Now, so now you are on your shins here. Now, go ahead and sit. Yeah, you'll probably be okay. You can sit so that you're up like this now, and you got to kind of get your butt cheeks out of the way. And now we're right on top, and you can hold on to your knees to help hold you up. Now again, we're right on top, and notice how just changing the position of the legs changes the position of the pelvic floor and the sensation. And you can do your breathing again. And you can see how beneficial this is for pregnant women who don't have who actually lose their sense of their pelvic floor because of maybe a vaginal birth, or we've got things too that we have to consider is past trauma, not just birth trauma. That this area is a very sensitive area. So go ahead and in the resources, I will put, it's the, I'm pretty sure it's just called pelvic floor awareness exercises, something like that. But I think that's where I use the ball, and it's, it's much more intense being able to get in there. It shouldn't hurt though. So that's the number one thing, is if it hurts, that means that you've probably got a place that's really, really tight, and you want to ease into it. So we never want to be hurting ourselves. So, okay, so that was it. We had the spine dance, we had hug the baby or the belly, and then these pelvic floor release exercises, a few examples of that. So do you have any questions on those? No? Okay, all right, good. Okay. So let me just grab a little drink of water. If you need to grab a drink of water, go ahead and do so, and we'll finish up here. Okay. Okay. I'm gonna go back to my share. So, okay, so now you've been here religiously and committed yourself to being here, Dorianne. It's fantastic. Like I just have to commend you for that. So thank you so much. So now this is where you get to make your contribution, and this is what I ask, because this is really where you start to this is how you start to build your confidence and competence, is actually practicing. So within the next 24 hours, you want to teach one of the concepts you learned here. Okay. And again, they don't have to be pre or postnatal. They can be a friend. It can be anybody. The point is that that's the only way that we get better, right? Is practicing. Like I said before, we can't learn to swim by reading a book about swimming. It's the same thing with teaching. And that's why weekend certifications don't work. That's why I have several students, teachers, Pilates teachers that are students that have gone through, quote, pre and postnatal certifications and are in my course, because the weekend certification doesn't work. Okay. If you're looking for confidence and competence, okay. Just because you have a certificate and then you're left to be on your own, that doesn't help much. So, okay. So the bonus here again is that you can take a pic or a video, tag me on Instagram, and I'll share it on my story. Remember that your client is whole. Remember, she is nature, adaptable and resilient. Be an advocate for movement, and just thank you for your dedication to the special population. So, oh, I already did that. That's that. Okay. Now I'm going to introduce you to, if you want to hear about it, you want to hear about the Academy? Okay. Okay. So the Pregnancy Pilates Impact Academy it's 100% online. Teach as you learn educational experience. Okay. So teach as you learn, meaning if you are a certified Pilates teacher, okay, Pilates, and you're in the Academy, and the whole philosophy is you learn something and you go teach it. I highly recommend that you get friend, you can have a client, anyone, somebody who is pre or postnatal, ideally, okay, that you can start working with and practicing these skills. That's how I got started. I started working with a friend who was pregnant. That's how you get started. Okay, if you've never worked with this population before. And so it's an educational experience. We've trained over 100 Pilates teachers now to be confident and competent perinatal Pilates specialists, which will be your title, who are all making a meaningful contribution to this world. Oh, yeah, I wanted to do my little metaphor here of the difference between a weekend certification and spending a few months. I mean, you really want to spend like 4 to 6 months in this. But this is just a little metaphor I came up with, that the difference between a weekend certification and spending a handful of months implementing it is like following the map on your smartphone. So basically, okay, so this is, I've been practicing this metaphor for a while because I think that it makes so much sense. So tell me if it does, if you can resonate. So, you know, when you look up an address in maps, right? And you have like 2 or 3 routes that come up, okay? Those are what Google or iPhone is saying, okay, yeah, this is going to be the best route or the quickest time. Okay. If you don't know that city, okay, then those are the routes you're going to take because you don't know any different, right? You don't know that if you know the city, you know that those 2 or 3 routes are not actually, may not be the best routes because you know the city. So that's like the difference between, you know, going, you know, with the cookie cutter, understanding, you know, just enough, I guess, just enough to get by. You know, you can follow the instructions on, like on the map, you can follow the instructions on teaching pre and postnatal, or you can really get to know the way of teaching and master, really it's mastering that training and be able to teach specifically to the woman that you're teaching to, knowing the difference between, for example, whether or not you need to cue the pelvic floor or not for this specific client. So that, and that's how it feels. You know, if you're in a city you don't know, you got to follow the map. If you're in a city you do know, and you're like, oh, well, those 3 ways, yeah, that's good, but this is actually going to be a better way. These back streets feels so much better, right? So that is what it's like. So here's just a few of our perinatal Pilates specialists. Anna, who's in Poland, she's been teaching for several years. She does all, if you're not following her, I recommend you follow her. Just to, everything she does is in Polish. She's very popular there. She has, I think she teaches mat and props. She doesn't do equipment. And she's got a full-time gig teaching online and in person for pre and postnatal. Flora's in Hungary. She was actually a perinatal medical massage therapist who also specializes as well. She does different things. She's writing articles now for, and again, also in Hungarian, she's writing professional articles now for different sites that need her expertise in pre and postnatal. And then Rachel in Massachusetts, she is, she just renovated and added on a studio in her home and teaches private lessons. She's actually getting ready to start a community class for pre and postnatal as a way to just bring this work to communities. And she's got 2 little girls there. So that's just a few examples of our perinatal Pilates specialists. Okay, so after you enroll, you will get immediate access to your new, what we call Impactors library. You will see Foundations, the Pregnancy Pilates Impact Academy, okay? That is where the bulk of the information is. Let's see. Here, okay. So this is what I call the fundamentals, okay? So you've got chapters 1 through 10. We start with your impact, okay? It's everything we kind of started to talk about with creating a mission for yourself, a personal mission. We have a skills inventory that we have you do right in the beginning to help you determine what your strengths are and what you can contribute in your quest of education with the academy. Then we have anatomy. Actually, can I go through each of these solo? Yeah, I will. Okay, let me just show you this first. So the first here. Okay, so you're also going to get the printable PDF manual. It's over 300 pages. This is just for the fundamentals, okay? We don't have this yet for the exercise sections yet, working on it. But this, at least for those of you who like having that, physical piece of paper, which I love having, you can get that printed for yourself. Okay, so here's the fundamentals. This is what I had mentioned before, your impact. This is the history of perinatal Pilates. We go through safety of Pilates as well, and then your personal inventory. Anatomy, this is understanding anatomy from a fascial whole body perspective, like we talked about on this training. You are also taught how to teach clients about their body, which we talked about a little bit. Physiology is hormones, nervous system. We talk about stress, good and bad. We talk about the vagus nerve. There's a special section on that. We talk about cardiovascular, anything that has to do with physiological of pre and postnatal. We have common problems. Okay, so this is common problems and how Pilates can help. We talk about the truth about pelvic pain, backed by research. We have a whole section on perinatal mood disorders. We have a section on prolapse, incontinence, and then we actually have an entire separate course on diastasis recti, so you can really grasp that. Fundamentals on perinatal exercise. So this is just your basic exercise goals and focus. Okay, what you do for each trimester. We go through, this is where you're going to find breathing. This is where you're going to find all the basics of a session. Okay, besides the actual core of a session. Okay, so this is like the warm-ups, fundamentals of everyday movement, those types of things. And then we have an entire section on everyday movement. So we talk about posture, the research on posture. We talk about lifting and lowering, how to teach safely to do that. We talk about squatting. We do gentle hanging. Tons of short clips in this chapter on anything you can think of, from getting gas at the gas station and how to stand doing that, to standing at the sink, washing dishes, and because this is what matters. I mean, we always say, we teach our clients inside of the studio how to, execute a great movement and feel amazing. And then if we're not applying it to outside of their lives, they're going to walk right out there and just go right back to what they are used to doing. So you have, I think most of the time teachers think that that's kind of a given, that you don't have to, Pilates is going to shift that or change that, but it doesn't naturally. You have to tell them, you have to teach them. And so we know that it is what a woman is doing outside of the studio that's causing issues like diastasis recti, pelvic organ prolapse. If you read the Body Patients Guide, you know that. All right, then we have special considerations. So this is where we have all the special circumstances, lessons on IVF and Pilates, hernias and surgery, endometriosis, breastfeeding, and miscarriage. We have, so this is impactful sessions. So this is how to conduct, this is basically pulling it all together, how to conduct the biopsychosocial consultation, which we talked about. We have that short form that I'm giving you access to. Then we also have the long form, which is intended for women that you're going to spend a long time with, that usually during private, that you're going to be doing private sessions with, okay? And then, create life-changing sessions that go beyond the exercises. This is the planning guide that we have, just an example, so printable, that you can basically print it out, and then you can see where you have, this is where, again, your creativity comes from, using what you're learning in the course to fill in what exactly are you doing, what exercises are you doing. But then you have on the side there the different cues to use. Make sure that you're adding that fascial 3D movement in. towards the end, we do the grounding goodbye, where you have talk about how to live their life happily, basically, and little ideas for adding in that life-giving social part of their being. They can go out there after your session and feel amazing. Okay, then we also have personal and professional development, which is vital here. So we have confidence and competence builders in here, how to get over imposter syndrome, and then expert impact. So this is where we have a collection of expert interviews with different professionals in pre and postnatal, in fascia and movement, and I'm always adding to these as well. So again, you're also going to get, this is super, super cool. Everybody loves this. It's a quick start guide. So basically, the number one thing people say is it's a lot. Course is a lot. And it is. It's, if you want to be confident in what you're doing and master this skill, this is what it takes. However, to make it so that it is not so much at once, in the very beginning of the course, you'll find the quick start guide. You also have quick start audio. So an audio that goes with this that kind of just gives you the basics. And there's a quiz that you can take afterwards that basically is just going to say, do I know the basics to at least feel confident enough to get started practicing? And then jumping into the meaty stuff, the difference, jumping into really getting to know the city versus just following the map. Okay, then you have the entire exercises for mat and props. You're going to find classical in here. You're going to find contemporary for pregnancy, first, second, third trimester, labor preparation, and postnatal healing. We've got ball, we've got small ball, roller, wall work, tons of different exercises to pull from there. And then we have the apparatus. We have reformer, trapeze, and the chair is what we work on, okay? For both prenatal and postnatal, it's broken up into, for postnatal, it's broken up into beginning healing, intermediate healing, and advanced healing. Prenatal is broken up into, I think it's like minutes. So like how many, like 15-minute session, things like that pulled together. A lot of the sessions have anatomy inside of the, when you log into, we use a platform called Kajabi, which is super cool. It allows you to basically have a description. So in a lot of the descriptions, you're going to get an overview of the anatomy. Not all of them have this, many of them do, describing what the exercises do. And then there's an area under all these lessons where you can comment and ask questions on each specific lesson, which is super helpful. Okay, you also get this bonus workshop. This is the 34 mat safe perinatal variations masterclass series. You're also going to get these 2 posters sent to your home. You're also going to get access to our community where we do research roundups. We do members meetups. Our first meetup is actually this Thursday. And we do mini trainings, Q&A. As of right now, it's through Kajabi. So basically when you go into your library, let's see. So when you go into your library here, you see it down there. But I'm thinking that I might change it back to a Facebook group, because I don't know. I'm not really liking the setup. It's not real interactive. But that is where we're going to do like meetups. So it is like Zoom, but everybody, it's really fun. Like the meetups are super fun because everybody comes together, and I'll do like a little bit of teaching. We'll do some personal development. We'll do a few bonus exercises, and then we dive into whatever anybody is dealing with, whether it be just teaching in general, marketing, designing classes, anything. So that's what the community is for. Okay, then we also have the Impactors Boost. So this is just where we have what I call extra bonus workshops that don't really fit into the actual curriculum. And some of those workshops are, this is a new one, fascia of a perinatal woman. We go through embryology, the womb and fascia as an energy conductor. We have body image masterclass, how to support your clients in body image struggles. And it helps moms to appreciate the body for the miracle that it is. You also get, okay, business boosting workshops, which I am super excited about. I've been offering this for a little over a year now. And I believe that as soon as you feel ready, you've taken the initial quiz to say, yes, I'm comfortable teaching, and you're already running your own business or working for however it works out that you're creating income for yourself. You can learn from this, and if you have any desire to work online, you've got that here. This is more for, I guess you could use it online, but it's more specific for teaching in person. So rather than that 10-pack that we tend to do, or the 5-pack, whatever it is, this method is going to teach you how to have a dependable stream of income. And pre and postnatal women are the most amazing clientele for this, because they have a built-in deadline. So you would basically, it works like this. You would create packages that are around whether they want to do full prenatal into their postpartum period. So let's say that's like 8 months. Let's say they're postpartum. So you would put them into a 4 to 8 months of a session planning. And the way that the income becomes consistent is you put them on a plan to pay you every month versus a big chunk up front. If you, it's totally up to you. Like, I know for me, that was always an issue. So I was really excited to find this method comes from my business coach, James Wedmore, who teaches all of this stuff, and it works. So I'm so excited to be able to offer that to teachers. And then you also have social media. It's called Selfless Social Media. Stop caring what people think and start posting with purpose. So that is pretty much the gist of the Pregnancy Pilates Impact Academy. So I ask that you consider, when your actions come straight out of your vision for your life, you radiate joy, and your passion effortlessly carries you through your day. And that's what this is the Pregnancy Pilates Impact Academy is so much more than just your course that you come and you learn things. This is about not only fulfilling your life, but then obviously fulfilling your clients' lives.